Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. Go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. It's a great study guide, great refresher if you're out in practice. Absolutely no cost to you. Simply an email will get you access to that. We'll also get you updates when we've got new podcasts available, as well as other content. So, again, go check that out, reallifepharmacology.com. All right, the drug we're going to tackle today is called Lotrisone. This is a combination medication, a topical agent of betamethasone, as well as clotrimazole. Clotrimazole is an antifungal agent. Betamethasone is a topical corticosteroid. Now, where is this medication going to be used for? It's going to be used in the management of athlete's foot, so fungal infection in the feet, and then jock itch as well as the primary indication, as well as athlete's foot that I've seen this utilized for. And that's caused by a fungal infection, obviously, as well. So a little bit more detail about a couple of these indications. So tinea curis is commonly known as jock itch, again, fungal infection that affects primarily the groin area. So it's a kind of a red, itchy, can be ring-shaped rash in the inner thighs, groin area, even progress to the buttocks area. It tends to spread, or it can spread, and it will have a well-defined, or typically is going to have a well-defined border there as well. It's kind of some of the signs and symptoms. You can have some scaling of the skin, flaking of the skin, and if severe enough, you can have some blisters there as well. How does somebody get infected? Typically, it's going to be contact type infection, where it's spread by direct contact or contaminated surfaces with other people who have tinea curis. Now, tinea pedis, that's the more technical, fancy definition for athlete's foot. Again, caused by a fungal infection. Why it's called athlete's foot? We have those warm, moist environments, and kind of the classic example is shared shower space, where you've got moisture, you've got warmth, and you've got potential individuals that can spread this infection. That water is mixed in, sharing of those bugs potentially released, or those fungi potentially released off of an infected individual's foot. So definitely a good idea to, kind of wear sandals, avoid those environments if possible, keeping those feet clean and dry, wearing breathable shoes. Those can kind of help that infection from progressing and growing there as well. So again, hopefully with some of that background, you understand why it's called athlete's foot, because of some of those risk factors there. All right, so getting back into the medication more. So clotrimazole is an antifungal agent. Betamethasone is a topical corticosteroid. Mechanistically, so the clotrimazole piece of it, it inhibits biosynthesis of ergosterol and other sterols, and this damages the fungal cell wall membrane and alters its permeability, and obviously leads to kind of the death and destruction of that fungi. Now, betamethasone, that's going to be utilized to help with some of the inflammation and redness and itching symptoms. So mechanistically, it aligns with kind of your traditional corticosteroids, of course. We've done plenty in the past. Go take a peek at prednisone, for example, in the podcast as to the actions of what that medication does. The betamethasone piece obviously is going to help with that redness, itching, and inflammation. I do want to note that I believe it's psoriasis.org has a nice little chart of potency of topical corticosteroids. It's always nice to kind of review that a little bit, but betamethasone falls on the higher end of the corticosteroid potency. As far as formulations, there's a cream and lotion type formulation. Most often I see the cream utilized. As far as that administration, we're going to give a thin layer Typically going to be dosed twice daily. Usually that treatment duration is 1 to 4 weeks. Jock itch, generally recommended up to about 2 weeks. With athlete's foot treatment, that can be a little bit trickier, a little bit tougher to treat. Sometimes we may go up to 4 weeks for the treatment there. All right, so let's talk a little bit of cautions, adverse effects. So it's not recommended to use this medication in children less than 17 years of age. And they tend to absorb a little bit more through the skin, and obviously the risk for HPA axis suppression goes up a little bit in that patient population. Also recommended to not use Lotrisone for diaper rash, and I think that's probably self-explanatory. Again, growing pediatric patients may have a little bit more absorbable skin, or that medication may be better absorbed through the skin in those type of patients. And again, we want to be really, really careful in those pediatric patients. So let's take a quick second, talk about that a little bit, that adrenal suppression. So systemic absorption of topical corticosteroids may cause that suppression of the HPA axis. Ultimately, that can lead to signs of adrenal suppression, also known as adrenal insufficiency. We can have, fatigue, weakness, weight loss, skin pigmentation. In severe cases, we can have, syncope, low blood pressure, dizziness, nausea, and vomiting, and ultimately, even loss of consciousness if it's that severe. So again, not something I'm typically going to be worried about in the treatment of, small area of athlete's foot or jock itch, for example. But if you do have patients that are using it inappropriately, excessively, for longer durations, that can be a risk with the long, frequent use of a medication like this. One other thing I wanted to mention with the administration of this medication, obviously it's going to be applied topically. Important to wash hands before and after. Topical corticosteroids, if we touch the eyes, those type of things, if we have that contact, it can certainly increase the risk of eye issues, cataracts, glaucoma, things of that nature. Again, on a one-time basis, probably not going to be a huge deal, but obviously we don't want to get that medication as well as the risk for contamination into that eye. That's more so on a prolonged issue, prolonged period, that's going to be more of an issue there. Other potential risks, adverse effects. Anytime you utilize, medication topically, we could have some irritation, some redness, those type of things. That's probably going to be the primary risk for adverse effects. And then monitoring, we're going to, obviously keep tabs on adrenal suppression. Again, from my perspective, if you've got a week or two prescription for this medication, probably not going to be high on my radar to look out for. But if I see a patient getting repeated use, repeated prescriptions, for example, that's a situation where we want to make sure that we're doing some patient education there. Also making sure that the provider, whoever's working with that patient, is aware of that as well. For some of the risk factors there. I do want to talk about one patient education piece of it. This is something I have seen come up in practice where patient goes home, start the medication. Let's say they're using it for athlete's foot, for example. Sometimes patients will have the anticipation that will resolve very, very quickly. Within an hour, within a day of applying that medication to the site. They may have that expectation that it should clear up very, very quickly. And with fungal infections particularly, it can take a little bit longer. So, generally that kind of full recovery, or at least, notable improvement, is going to, take a week, maybe even up to a week and a half, 2 weeks. So, pay attention to that. Make sure patients are educated that, this is not going to instantly cure your athlete's foot within a day. Okay, so make sure patients don't have that expectation because it typically takes a little bit longer there with fungal infections. All right, let's take a quick break from our sponsor, and then we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, geriatrics, BCMTMS, NAPLEX, go check out meded101.com/store. We've got tons of resources there that can definitely help you pass your board exam. If you're a pharmacy technician, we've newly released, it's over an 8-hour course preparing pharmacy technicians for their certification exam. That link will be at meded101.com/store as well. And we've also got plenty of other resources for nursing professionals, med students, PAs, nurse practitioners as well. So again, all those links, go support the sponsor, meded101.com/store. All right, wrapping up with drug interactions. With topical agents, I typically don't stress too much. I will highlight a couple of things here. So first and foremost, clotrimazole. There is a potential with some significant systemic absorption that it could increase tacrolimus concentrations. Again, pretty rare that somebody's on tacrolimus, but if you've got a transplant patient or somebody using this medication for immunosuppressive purposes, keep in mind clotrimazole, frequently used, higher concentrations, may alter the systemic concentrations and cause an increase in tacrolimus concentrations. The other thing I wanted to mention was CYP3A4 inhibitors. There is potential that CYP3A4 inhibitors may increase serum concentrations, systemic concentrations of betamethasone. Again, not something I'm crazy worried about, but I think something to be aware of, particularly if you've got patients on significantly strong CYP3A4 inhibitors, as well as taking betamethasone frequently or for higher dosages or longer periods of time as well. And then, of course, there may be some risk with that systemic absorption of the corticosteroid. If it's excessive use, higher dosages, we could run into some of the same issues that you'd see, for instance, with taking prednisone, for example. Again, not very likely, but there may be a rare case out there. So things I think about there are, hyperglycemia risk. So that kind of opposing what we're trying to do with diabetes medications, for example. And I'll go through a bunch of others. So if you go listen to the podcast on prednisone, for example, I talk about all these systemic effects that can happen. Again, not very likely to happen with a topical corticosteroid, but again, something to be aware of, certainly, if we've got patients that are excessively using this medication. All right, well, I think that's going to wrap up the podcast for today. Do me a huge favor, leave a rating review on iTunes or wherever you're listening. Greatly appreciate that. Certainly support the sponsor, meded101.com/store. Any purchases there go directly to support this podcast, and I greatly appreciate that. So again, meded101.com/store. If you have any questions, comments, feel free to reach out to me, mededucation101@gmail.com. You can also connect with me on LinkedIn, Eric Christensen, PharmD, BCPS, BCGP. I'm going to sign off for today. Thank you so much for listening. Take care, and I hope you have a great rest of your day.